There's a push by some Kentucky lawmakers to make getting mental health crisis help easier.
WDRB's Travis Ragsdale explains how 3 numbers might make a world of difference.
For years, the National Suicide Hotline was a long 800 number that was nearly impossible to remember. But that's all about to change. Beginning in July, that will go from this to just 3 numbers, 988.
It will make a mental health crisis line as accessible as 911.
Passed by the federal government in 2020, creating this new national number is supposed to make mental health services for people in crisis easily accessible.
The goal is to have a mental health safety net in the same way that we have a physical health safety net with 911 services.
There's just one problem: money. Kentucky House Bill 373 aims to solve that. If passed, the 988 line would be funded by mainly adding a 70-cent fee per month per line on cell phones.
It creates that funding stream in the same way that 911 is funded, through a small fee on your cell phone bill.
And better access is what experts say is needed most right now as calls to the hotline drastically increase since the start of the COVID-19 pandemic.
Not only the calls increase, but the intensity of the calls increase significantly.
The House bill has not yet been voted on, but does have bipartisan support. It would also ensure that calls to the new 988 hotline would remain local.
And that would fund not only the line itself, getting it established in Kentucky. Currently, our community mental health centers answer the National Suicide Prevention Lifeline calls, and they will continue to do so with 988.
Travis Ragsdale, WDRB News.